According to a report from the U.S. Center for Disease Control, there are more than 1 in 3 Americans who suffer from prediabetes but do not recognize the symptoms. These symptoms raise our blood sugar levels but not high enough to be considered diabetes type 2. Some of the symptoms that go unrecognized are fatigue, frequent urination, and thirst. Unfortunately, most Americans or people just chalk these up to being tired from work, our everyday lives, or even stress. I am one of those people who was diagnosed as a pre-diabetic, but with the help of my healthcare provider, I have been able to make lifestyle changes and incorporate exercise into my daily life. It is a lifestyle change that is hard, but is something that in the long run is going to be better for my future health. Prediabetes can be cured just making some lifestyle changes with exercise and changing our eating habits. Today, I am here to tell you a little bit about prediabetes and how to keep it from unraveling into type diabetes 2. First, it is a good idea to seek the help of a healthcare provider. They can run blood work, which in turn gives them a report of your A1C level. The A1C test gives you an average of your 2 to 3 month span blood sugar levels. Secondly, depending on your numbers, unfortunately, you may need the help of some medication to bring your levels to more normal range. Lastly, it is good to incorporate exercise into your everyday lifestyle, at least 150 minutes a week, which in turn is about 30 minutes a day, at least 5 times a week. There are some things to look out for that may signal prediabetes. Prediabetes is when our sugar levels are raised but not high enough to be considered diabetes type 2. Prediabetes is when our A1C level is anywhere from 5.8% to 6.4%, as shown on this chart. Once it passes the 6.6%, then you are considered into diabetes type 2. A healthcare provider will usually run an A1C test, which, like I said before, gives you an average of a 2 to 3 month span of your blood sugar levels. It also helps to test your blood sugar level on a daily basis in the morning while fasting. You can use a meter similar to this, which pokes a small amount of blood from your fingertip, put it on a strip, and then this meter will give you a reading. If it is anything below 120, then you are still in the pre-diabetic category. But if you can get it to be below 100 and or below, and your A1C levels are anywhere from 5.7 and below, then you have then a normal reading and are no longer considered into the prediabetes category. Prediabetes is caused because our body does not respond well to the insulin. Our pancreas tries to make more insulin than is needed, and eventually it cannot keep up, so our blood sugar levels rise and unfortunately can rise high enough to be either prediabetes or diabetes type 2. Insulin is a hormone that is produced by the pancreas, which helps us to get blood sugar into our cells to produce energy. If you are considered a pre-diabetic, you run the risk of going into diabetes type 2 or having health problems with your heart, which can eventually lead to stroke. An exam by your healthcare provider can help you to prevent any of this and to get your blood sugar levels to be more normal. Getting your blood sugar levels is also important to be tested if you have any of these risk factors. If you are overweight or have had a sibling, a brother, sister, or even a parent who has diabetes type 2. For women, it is also important to look out if you have suffered from gestational diabetes during a pregnancy. Exercising is one of the ways that can help you to lower your blood sugar levels and get you at a normal range. It is good to exercise, like I mentioned, at least 150 minutes per week. Some of the good ways to exercise are a brisk walk or even swimming. Exercise helps us to use our body's insulin and helps us to produce muscle, which brings our levels to a normal range. It is also helpful in weight loss, and if we can lose at least 7% of our body weight, it'll help us to keep our blood sugar levels also at a more normal range. Eating habits are also very important, and it is good to change them and eat things that are a little bit more healthy to help us in the long run, such as it's good to follow a diet, almost like a diabetic meal plan, so that this way can help to prevent it from going into diabetes type 2. Eating green leafy vegetables such as or fruits and legumes such as beans or lentils, grains, nuts, and seeds are a good part of a great healthy diet. It's also important to just have low fat dairy products, lean meats, and include them in your meal plan as well. It's best to try to limit your trans fat and saturated fats and starchy vegetables such as potatoes, corn, and peas because these turn into sugar right away. Limiting the amount of fruit juices and sweet drinks such as sodas is also important. It's best to just have the natural fruit juice, which you can get yourself from the fruit, or to just have the piece of fruit rather than waste the calories on sugary drinks or juices. Taking care of prediabetes before it unravels into diabetes type 2 is very important. It is best that if you feel you may be at risk, that you get checked by a healthcare provider so that they can help you to get on the right track immediately and stay healthy. If you do test as pre-diabetic, it's best to follow the instructions that are given to you by your healthcare provider and keep your appointments as scheduled to ensure that all is well. Like with any other illnesses, it is best to read up on it and learn as much as you can so that you can help yourself to overcome this and onto a healthy track in life. At the beginning of my speech, I mentioned that many people do not recognize the symptoms of being pre-diabetic. I hope with the information that I have provided you today, it will help you in the long run. As said by Dr. Adrian Vella, exercise, diet, and in some cases medication, along with other lifestyle changes, can often be very effective in returning blood sugar levels to a more healthy range and protecting your health into the future.